Today we're speaking with Dr. Peter Ravdin. He is director of the Comprehensive Breast Health Clinic at the Cancer Therapy and Research Center, that is at the University of Texas Health Science Center at San Antonio. Dr. Ravdin is also co-director of the San Antonio Breast Cancer Symposium. Thank you for joining us.
Well, thank you very much for inviting me.
What are the goals of the SABCS?
Well, the goals of the SABCS, or the San Antonio Breast Cancer Symposium, have always been to present the cutting-edge work being done in the application of ideas that arise from science or epidemiology or elsewhere, and also to provide people with information about advances in the sciences, particularly the translational sciences. So one of the things that's been really wonderful about the San Antonio Breast Cancer Symposium is it brings together people from disparate backgrounds, from different parts of the world, also from different intellectual territories. For instance, people that are laboratory researchers, people that are pathologists, people from all the clinical domains. And there's essentially a wonderful chance to, first of all, view what the exciting results are and where the cutting edge is in other people's fields. And then also to personally meet them with the idea that collaborations will develop. And this not only goes on here in the convention center, but there are many satellite meetings that are part of the symposium. So I think that there's a lot of work that's done that really allows people to explore new areas and new kind of collaborations to develop.
You play a major role in selecting abstracts and other presentations. From your perspective, what notable study results are being presented this year? And also, could you talk a little bit about the breadth and depth of science that is presented here?
Okay. Well, I think that this symposium involves a lot of work. In fact, tomorrow, within an hour of finishing the symposium, we'll have our first meeting for the 2011 symposium. And so there's a lot of work done by a lot of individuals, but part of the work that will start in the spring will be basically the selection of speakers and special areas for mini symposia, and that will be launched first. Then in June and July, people will get together and we'll review the submitted abstracts and select the abstracts both for selection as per the oral presentations, which are the most prestigious in some ways. But I will say that the poster sessions are also wonderful in that poster session allows for more time for two-way feedback. So that's what happens at that point. And so we all participate in those, and there are different committees that participate in selection of invited speakers, the mini symposia, and the abstracts. In terms of what's exciting at any given time, I think the most anticipated presentation at this year's symposia was a trial called the Azure trial, which is a trial that explored whether or not bisphosphonates were going to work in adjuvant therapy. And there was a trial that had been done by the Austrians and presented here 2 years ago. Actually, it was presented at ASCO 2 years ago. And it had a spectacular result. Basically in premenopausal women who were taking ovarian suppression and hormone therapy, if they took zoledronic acid, they had almost a 1/3 reduction in the risk of relapse and death. And one of the great disappointments of this meeting was that when you look at the result, there was absolutely no overall impact in the patients. And there's some subset analysis that's being done, and there's a hypothesis put forward as to who will actually be the people that benefit. Clearly, it's not going to be everyone. And so in that regard, there's both a European trial and an American trial. And if both of those trials show benefit in the same subsets as this, perhaps together it will change practice. I don't think that which would have been instantaneously a practice-changing trial will itself at this point change practice. There are a lot of other trials that were presented in my mind, the ones that are the most interesting, the ones that are most interesting are the ones which included biological correlative studies. Most of that was not presented at this meeting, but are things that are going to be analyzed, because now every big trial requires tissue donation, and for the analysis, looking for what are predictors. To me, what was really exciting about this meeting is the number of targets that are being identified by the basic scientists, the number of agents that are actually have been in development for hitting those targets. And so there's just a huge kind of movement forward.
And finally, what's your feeling overall of progress being made in this field?
Yeah. Well, it's interesting. Last night I went to an advocacy, breast cancer advocates meeting, and there were 4 of us there who do different kinds of research. And one person stood up and said, you know, it's so discouraging you haven't actually conquered breast cancer. And in a way, I agree with her in that, of course, we'd all like to have, conquered breast cancer years ago. But the reality is, I mean, we're making huge strides. The ability to, and all the hypotheses relating to the heterogeneity of breast cancer, the great mixture of targets that are out there, the possibilities that we may be able to understand and get a handle on the resistance mechanisms. And when you realize that in 1975, there wasn't screening. There wasn't anything for prevention. There wasn't anything really for adjuvant therapy of breast cancer yet. We were just on the threshold of that. And that surgery at the time was relatively barbaric by current standards. So I think anybody that wonders whether or not we're making progress just needs to look at all the technologies and all the things we can do things for now that we couldn't in the past. And one of the presentations today was showing actually what the breast cancer mortality rates are doing. And the breast cancer mortality rates are dropping worldwide, which means that all of these things, when you put them together, really do make a big difference.
Well, thank you so much, Dr. Ravdin.
Well, it's my pleasure.